All righty. Good morning, good afternoon, good evening. This is Dr. Kaz, and I am bringing chapter 14 your way, the spinal cord. And we are going to wrap up this chapter and talk about reflexes. So let's first discuss what a reflex is. Now, in a moment, we'll talk about the different types of reflexes, and you're going to find out quite a bit in Bio 211 about the visceral reflexes. A lot of systems are governed by reflexive coordinated actions. For example, the digestive system. Ingested materials will prompt the movement and further mechanical and chemical digestion of certain substances in your gastrointestinal tract. So let's talk about some of the characteristics of our reflexes. First, let's define what a reflex is. It's a rapid, pre-programmed, involuntary response of a muscle or glands. But most importantly, all right, it's a response to muscles or glands from a stimulus. We need a stimulus in order to have a reflex. Now, if you notice, muscles or glands, those are the effector organs. So basically what we're saying is a stimulus is going to cause some sort of response from our effector organs. Okay, so reflexes are, yes, rapid. All right, the fewer the number of neurons in a chain, the quicker the reflex. Monosynaptic reflex will be faster than a polysynaptic reflex. Our reflexes are also pre-programmed, which means they will be the same every time they occur. And these reflexes are going to be involuntary, right? You will not be able to consciously prohibit the reflex to occur. Most times when you are aware of what the reflex, of what kind of reflex just occurred, right? It's already too late. So think about reflexes as survival mechanisms. Perfect example is the withdrawal reflex. If you touch something that's hot or dangerous, you will prevent extensive damage by pulling away. And so this is what happens to us, all right, during our adaptation process. We develop these reflexes, and hopefully we'll continue to have these reflexes throughout our lifespan. So I really stress that you memorize this slide right here. Okay, this is figure 1419, right, in your textbook. This will be a very helpful reflex, or excuse me, slide to look at, because, like I said before, when you get into some of the other systems throughout this course and the next course, the second part of this course, this will help you to have a general understanding when we're discussing the reflex arc. So, of course, our reflex arc is going to be initiated by a stimulus. So that stimulus will trigger or activate a receptor. The example here is a pain stimulus, right? That nail being driven into the skin, all right? And the pain receptors are going to transmit that sensory input information along the sensory neuron into the spinal cord. So it'll travel up the individual nerve into the spinal nerve, then through our posterior or dorsal root. Remember, only sensory information will come into the spinal cord this way. And then it'll enter into the spinal cord and synapse. In this picture here, we're going to see it synapsing on an interneuron. That interneuron has a collateral, which is going to send information up to the brain. And that's usually where you'll get that conscious awareness of what just happened with the reflex. But by the time that happens, the reflex is already over. So the sensory neuron synapses here on our interneuron, not necessarily going to happen every time, but then that interneuron is going to synapse onto our motor neuron. And that motor neuron here is located in the anterior horn, which means if it's an anterior horn cell body location, right, then that's going to innervate, all right, skeletal muscle. Okay, so this will be a somatic reflex here. And so that somatic motor neuron is going to exit out of the anterior root or ventral root, right, from the spinal cord. It'll meet back up in the spinal nerve. And then from the spinal nerve, it'll travel out to the nerve that's going to trigger the effector organ, in this case, skeletal muscle, all right, to contract the muscle and respond to whatever that stimulus is. All right, so how do we classify some of our spinal reflexes? Okay, so several ways. How do we classify our reflexes in general? So reflexes can either be spinal or cranial. That means if we're going to involve the spinal cord, there'll be spinal reflex. If we're going to involve the brain, that'll be a cranial reflex. It really depends what your integration or control center is going to be. Spinal reflexes don't involve the brain necessarily. All right, somatic or visceral, that depends on the effector gland. All right, if it's somatic, then we're going to utilize skeletal muscle as the effector. If it's visceral, we are going to utilize either cardiac muscle, smooth muscle, or a gland. Now, the latter three you will cover in much more detail in later chapters, just not in this course. Right, endocrine system weighs heavily on the glandular response. Cardiac muscle obviously is going to involve the heart when we're trying to increase or decrease heart rate. And then smooth muscle is all over the place. All right, if it's monosynaptic versus polysynaptic, right, monosynaptic means there's only one synapse. So basically, you'll have one sensory neuron that is going to synapse on a motor neuron. Polysynaptic, you'll have, all right, 3 or more neurons that are going to be involved in the reflex arc. Ipsilateral and contralateral. If the stimulus is on the same side as the effector, then it's an ipsilateral reflex. If the stimulus is on the opposite side of the effector, then that's a contralateral reflex. And then finally, all right, what determines if a reflex is innate or acquired is if it's an innate reflex, you were born with that reflex. Acquired, you will acquire or develop that reflex after you were born. All right, a nice example of an innate reflex is the suckling reflex. All right, when the baby is rooting, you just kind of brush the cheek there of the baby and it'll move towards that side. That's the stimulus, you brushing the cheek, and the baby will start to root and try to suckle on to whatever that stimulus is. Normally, when it's the mother trying to breastfeed, or if the parent is trying to give the baby a bottle, okay, it'll move towards that area where the stimulus is located. So here's a nice slide that's showing us both a monosynaptic reflex and a polysynaptic reflex. Again, monosynaptic tells you exactly how many synapses there are. Here is our one synapse between the sensory neuron and the motor neuron. That's going to be a quicker reflex than the polysynaptic reflex. Obviously, you can see here with the polysynaptic, right, we have the sensory neuron, all right, synapsing onto the inner neuron, then the inner neuron synapses onto the motor neuron, sending out that motor input to the effector organ. All right, so now what we're going to do is we're going to talk about, all right, some of our spinal reflexes. We're going to talk about the 4 common spinal reflexes. Those include the stretch reflex, the Golgi tendon reflex, the withdrawal reflex, and the crossed-extensor reflex. The first 2 reflexes are going to involve our proprioceptors. By now, we should know what the proprioceptors are. Proprioceptors are going to be those receptors that are located around joints, muscles, tendons, and the joint capsules themselves, and they are going to send back information to your central nervous system, right, as to the spatial positioning of joints and muscles and tendons and whatnot. So our first, all right, spinal reflex, right, is going to involve a muscle spindle. And the muscle spindle is the name of the proprioceptor that is going to detect the amount of stretch that's occurring in our muscle. I'm going to flip back and forth between this slide and another slide so you can see, right, the different parts of our muscle spindle. But let's talk about what the muscle spindle actually contains. All right, the muscle spindle is going to contain these intrafusal muscle fibers, and those intrafusal muscle fibers are going to be innervated, that means controlled, by our gamma motor neurons. So these muscle fibers are going to be triggered by a motor neuron, and then we're going to package up this little construct, right, with sensory neurons. So think of this, the intrafusal muscle fibers and the gamma motor neuron as the present, And then our sensory neurons are going to be the gift wrapping, right? And then the muscles that are not inside of our muscle spindle, we refer to those as extrafusal, outside, extrafusal muscle fibers. And they're going to be innervated by a much larger motor neuron. Alpha is the largest type of motor neuron. So that means, right, our action potentials, our nerve signals can travel faster. So when our muscle spindle gets stretched, it's going to send sensory input information to our control center. In this case, that's going to be our spinal cord. So once it gets stretched, the sensory neuron just starts to fire off, right, our nerve signals, action potentials, or nerve impulses to the spinal cord. So let's take a peek and see, right? First, I'll just kind of zoom in here and show you what our muscle fiber looks like here. Okay, so on the inside here, our muscle spindle, right, has the intrafusal muscle fibers, and they're going to be wrapped up, okay, with these nerve endings here, these sensory nerve endings. So when these muscle fibers, these intrafusal muscle fibers are being stretched, right, they will then trigger the sensory nerves or neurons, excuse me, to fire off nerve impulses through our sensory neuron. And then we wrap up our muscle spindle in our extrafusal muscle fibers. And the extrafusal muscle fibers are going to be innervated by the alpha motor neuron. That's the larger neuron. All right, the intrafusal will be innervated by the gamma motor neuron. Right, and those are smaller fibers. Okay. So let's talk about our stretch reflex. Now, look at the title of this reflex, stretch reflex. So this reflex is based on the amount of stretch that's occurring in a muscle. So when this muscle is being stretched, and usually this reflex is to prevent overstretching and damage to the tissue. So what will happen is when this muscle gets stretched, it is going to respond by contracting and shortening. So our muscle spindle is going to then be activated by the stretch, and it is going to fire sensory impulses along the sensory neuron towards the spinal cord. And then in the spinal cord, what we're going to see is those sensory neurons are going to stimulate the larger motor neurons, the alpha motor neurons, right, of that same muscle. And so that is going to cause that muscle to contract. So since the sensory neuron directly synapses on the motor neuron, the alpha motor neuron, that is a monosynaptic reflex. Now at the same time, okay, now the example that's being shown here in this picture I'll show you is the triceps brachii muscle. So the triceps brachii muscle in this example is being stretched. And so when it's being stretched, and then we elicit the stretch reflex, and the triceps brachii muscle will contract as a response to the stretch. But here's the thing. You know that the triceps brachii muscle is on the back of your arm, on the back of the brachium. And your muscle group that is opposite of that is the biceps brachii. So we want to make sure that the biceps brachii muscle group doesn't contract during this reflex. So here's what we're going to see. That sensory neuron, all right, that is stimulating the alpha motor neuron ipsilaterally on that same side to the triceps brachii is going to excite an interneuron in the spinal cord. And what that interneuron is going to do is it's going to inhibit the motor neurons to the biceps brachii muscle, or in this case, that's what we refer to as the antagonist muscle. And by inhibiting the antagonist muscle, in this case, the biceps brachii muscle, we prevent the biceps brachii from contracting. So they can inhibit the triceps brachii muscle from contracting. Because if you recall, the triceps brachii muscle at the elbow extends the elbow, whereas the biceps brachii muscle will flex the elbow. So this process is known as reciprocal inhibition. So we'll see the stretch reflex, right? When we classify it, it's going to be a spinal reflex, doesn't involve brain. It's somatic because our effector is skeletal muscle. It's monosynaptic because the sensory neuron is going to synapse directly onto the alpha motor neuron. It's ipsilateral, it's all on the same side. And this is one of those reflexes that you're born with. So let's take a peek and see. Okay, so here's our muscle fiber in the triceps brachii being stretched too much. So our sensory neuron, okay, that is wrapped around, or sensory neurons that are wrapped around the intrafusal muscle fibers are going to send sensory input information, right, into the spinal cord. So that sensory neuron will travel in through the spinal nerve, then into the spinal root, and then it'll come into the spinal cord and directly synapse onto our alpha motor neuron here. And when it synapses onto the alpha motor neuron, right? And also it will synapse onto the gamma motor neuron. And so it's going to excite both of those motor neurons, okay? But the alpha motor neuron is much faster because it's much bigger. It will cause the biceps brachii muscle to contract. And on the elbow, that will cause you to straighten out your elbow. Meanwhile, remember, we don't want the biceps brachii muscle to contract during this process. So that same sensory neuron is going to come in. It's going to excite our interneuron. And that interneuron basically has a binary choice. It can either excite the neuron that it's synapsing on, or it can inhibit the neuron that it's going to synapse on. Well, in this case, it's going to inhibit the alpha motor neuron that's going to the antagonist muscle group. In this case, the antagonistic muscle group to the triceps brachii are the biceps brachii. So we're going to inhibit these muscles so they don't slow down the contraction of the triceps brachii, so we can move, all right, we can extend the elbow and move it away from whatever that reflex is, or excuse me, whatever that stimulus is. So that's the stretch reflex. All right, so what now? Okay, that's our first spinal reflex. Our second spinal reflex is known as the Golgi tendon reflex, also known as the tendon reflex. But again, we're going to deal with our second proprioceptor reflex. So the stretch reflex, right, would prevent muscles from being stretched excessively, while the opposite of that is a reflex that prevents muscles from contracting excessively, and that'll be the Golgi tendon reflex. So our Golgi tendon reflex has its own little receptor complex called the Golgi tendon organs. And these are the proprioceptors that are going to be located where the muscle and the tendon, all right, are joining together. Essentially where you'll see the muscle start to transition into the tendon. As you know, the tendon is going to be the connective tissue that attaches a muscle to the bone, or a muscle to the skin, or a muscle to another muscle. All right, so what we're going to see is here, our Golgi tendon organs are going to have their own sensory neurons. And in this case, our sensory neurons, right, when they travel to the spinal cord, will be excitatory on an interneuron that sits inside the spinal cord here. Where at the same time, we're also going to see, all right, another set of interneurons that are going to inhibit, all right, they are going to inhibit, all right, that muscle that is being contracted excessively. What happens if we inhibit that muscle? Well, if we inhibit the motor neuron, then that muscle will not contract any longer, so it will relax. So this prevents us from damaging that muscle tissue. This is a polysynaptic reflex because it involves an interneuron. It means we'll have more than one synapse here. Now we're at the same time, right, with the Golgi tendon reflex, right, we have to consider our antagonistic muscle group. So if we are going to cause relaxation of our agonist muscle group, because it was contracting too much, and we're like, all right, we got to shut this party down. We got to stop this muscle group from contracting too much, right? Where at the same time, we want to enlist the help of our antagonistic muscle group. And so we're going to excite the motor neurons to the antagonistic muscle group, so we can cause contraction of the antagonistic muscle group. So it will actually cause a lengthening of the agonist muscle group because it had contracted so much. So that process is called reciprocal activation. And this is also going to be a polysynaptic reflex. Why? Because of our interneuron involvement. I'll show you the picture. Pictures are lovely. Okay, so here you can see, here's our Golgi tendon organ. Where is it sitting? Right here where the muscle and the tendon are joining up, all right, that junction area. So their job is to monitor the amount of tension that is occurring here, right, in the tendon and where the muscle meets, right, because when the muscle contracts, it will obviously generate tension. And if it's generating too much tension, we don't want to tear the muscle or damage that tissue. So when this is going on, that sensory information that gets generated by the Golgi tendon organ will then obviously travel towards the spinal cord, enter into spinal cord through the posterior root here, and it'll synapse onto an interneuron. It'll excite the interneuron. This interneuron is going to inhibit the alpha motor neuron that is stimulating the agonist muscle, the muscle that is contracting too much. So in this example, we're going to use the quadriceps muscle here, right? Your quadriceps femoris muscle group is contracting too much. So that is causing, right, your leg to be, the knee, we'll talk about its effect at the knee, all right, say it's extending too much. So we're going to inhibit the quadriceps muscle group, and we'll shut that down, and then that will cause this muscle to relax. Where at the same time, that same sensory neuron is going to excite another interneuron. And that other interneuron will excite its motor neuron to the antagonistic muscle group of our agonist muscle, which in this case happens to be the hamstrings group. And so what we'll see here is we're going to stimulate that muscle group, the hamstrings here, and the hamstrings on the knee will cause the knee to flex or bend, and that will cause lengthening of the quadriceps femoris muscle group there, okay, to kind of, I don't want to say stretch it out, but to prevent it from over contracting too much. And so that, when we're stimulating the antagonist muscle group, that's called reciprocal activation. When we were talking about the stretch reflex, right, when we're dealing with the antagonistic muscle group, we were going to inhibit them. So that is referred to as reciprocal inhibition. And that's the stretch reflex, where we have reciprocal inhibition. All right, so on to our third spinal reflex, which is the withdrawal reflex. Now, with withdrawal reflex, pretty much every single one of us is pretty familiar with the withdrawal reflex. This is the one in which you grab something that might be too hot while you're cooking and you burn yourself. So it would involve a painful stimulus. And so what we'll see is, just like the name of the reflex, we withdraw away from whatever that painful stimulus is going to be. So the receptors that are involved with the withdrawal reflex are our pain receptors, also known as nociceptors. And so the nociceptors are going to transmit, all right, that sensory input or that pain input from the nociceptors into the spinal cord. And of course, we're going to involve some interneurons in this scenario here. And so the interneurons will excite the motor neurons to, in this case, our flexor group. Okay, and so the flexors are going to flex. If it's in the upper extremity, it will flex the elbow, or if it's in the lower extremity, it will flex the knee. Right. The example that we're going to use again is going to be the lower extremity in this situation. So this will cause, right, the hamstrings to contract, and it pull, and causing the knee to bend, and it pulls the knee away from that painful stimulus. Now, at the same time, what we're going to see, because we don't want, right, a situation in which the antagonistic muscle group is going to happen to contract also. So what do? Right? We have some interneurons involved again that will inhibit the motor neurons to the antagonistic muscle group. In this case, that's the extensor muscle group of our lower extremity, right? The hamstrings in this case. The quadriceps in this case. And so that will cause those muscles, right, not to be inhibited, so they'll stay relaxed. And when they relax, right, they won't inhibit our agonist muscle group, in this case, the flexors, which are the hamstrings. And so we can withdraw from that painful stimulus fast. So let me show you. Don't pay attention to the right side of the page, only pay attention to the left side of the page. So here you are, you're walking along, okay, out in the woods, barefoot for whatever reason, and you happen to step on this sharp rock. So the nociceptors on the bottom of your foot, right, are going to be activated from that painful stimulus of that sharp rock, and they're going to send sensory input information up the sensory neuron, that's our blue string here, enter into the spinal nerve, into the posterior root, and then into our spinal cord. So that sensory neuron then is going to stimulate and excite the interneuron. That interneuron will then excite the motor neuron to the flexor group to that lower extremity. So the motor neuron will then travel down here to the hamstrings. It will cause excitation of the hamstrings, and it'll cause the knee to bend. Now, it's not shown here, okay? But at the same time, let me go back to this previous slide here with the withdrawal reflex, right? At the same time, right, the motor neuron, okay? Don't pay attention to the other stuff. The motor neuron that is going to be excited, actually, let me not even use that. I don't like that. I guess I'll just draw my own, right? We are going to see the motor neuron here to the quadriceps group that will be inhibited. It's not here in this picture, right? But just imagine another interneuron here that is going to be inhibited. Okay, so that motor neuron to the antagonistic muscle group, the extensor muscle group, in our example, the quadriceps femoris, those muscles will be inhibited so you can bend your knee fast. Which brings us to our last spinal reflex that we're going to discuss today, and that is our crossed-extensor reflex. So this is an example of a contralateral reflex, right? This reflex occurs with the withdrawal reflex, especially when you're dealing with the lower extremity, a weight-bearing structure. So same scenario, you step on something sharp. Okay, that sensory input gets transmitted to the spinal cord. In this case, what we're going to see when that sensory neuron, it will synapse onto an interneuron. This interneuron will be excited. And so that interneuron is going to cross over the midline there. So it's going to go, all right, from one side of the spinal cord to the other, and it is going to excite the extensor muscle group. Right, so it's going to excite the extensor muscle group on the other side of your body, in your other leg. So the quadriceps femoris muscle group, in this case, will be activated or excited. And so as you pull away, all right, the one leg from the painful stimulus, you're going to be left standing on the other leg. And so a lot of your weight will shift to the other leg. So to prevent you from falling over, we don't want your knee to buckle, or we don't want it to bend. So what we'll do is we are going to stimulate the quadriceps on the opposite leg to contract. That allows you to support your body weight and keep your knee straight as you pull your hurt limb or leg in this scenario away. Now you can pay attention to the right side of this picture. So here comes our nociceptive sensory input information from that painful rock. It comes over and it synapses onto this inner neuron. And that inner neuron crosses from one side of the spinal cord to the other. And now it'll be excitatory to the extensor muscle group, but in the other limb. And so it will stimulate the motor neuron to the extensor group. And so that motor neuron exits out of the anterior root, enters into the spinal nerve, then goes out to the lower extremity. And so you'll see it travels down, and it is going to stimulate the quadriceps muscles in the other leg, and that keeps the knee straight and allows you to bear weight of your body on this limb as you withdraw the other limb away, so you don't fall over. All right, so why are reflexes important? These types of reflexes, why are these spinal reflexes important? Well, all right, well, one, all right, again, like I said, it's a survival mechanism. So if we want to kind of check how your skeletal, your somatic nervous system is doing, and we want to test if we're suspecting that there's an issue with maybe some muscles or the nerves that innervate those muscles, all right, we can actually use these reflexes, all right, as diagnostic tools to help determine if there's an issue. So a lot of these reflexes, like the stretch reflex, for example, that's the reflex where you're sitting, that's the monosynaptic spinal reflex. That's the one where you're sitting in the doctor's office and the doctor comes over and hits you in the knee with the hammer, and your leg will jump a little bit. And so what they're doing is they're determining, all right, primarily your L4, okay, your L4 spinal nerve, but, okay, they're actually checking the femoral nerve. And the femoral nerve, and we'll talk about this in our lab class, right, what spinal nerve segments contribute, but the main spinal nerve segment that contributes to the femoral nerve is going to be L4. So what they're going to do is hit you in the knee, or not the knee, excuse me, hit you in the patellar ligament, and that causes a little bit of a stretch, okay, which is monitored by, all right, those proprioceptors, that muscle spindle. And so if your leg jumps, or a little bit, then we consider that to be a normal response. What happens if it is really small or altogether absent? Well, then what we'll consider is, all right, the possibility could be that there is some sort of damage to the nerve that innervates the muscle. Okay, so we'll think maybe something's going on in the spinal cord, or there's actually something wrong with the muscle itself, right? Something that caused a weakness in the muscle, or where the nerve and the muscle meet up. So some sort of issue going on at the neuromuscular junction. Right, so that's a hypoactive reflex, right, where it's diminished or it's not even occurring at all. All right, some situations, some folks, and usually this is people that have really good muscle tone, for example, bodybuilders or athletes, they might have a diminished reflex, and that could be considered a normal finding for them. So in certain situations, the physician or the medical professional that's testing the reflexes might have to use a different technique. There is one technique, it's called the Ginjasic maneuver, in which you ask the patient to almost kind of bear down like a Valsalva. And what I do is I ask the patient to interlock their fingers together, point their elbows away from each other, lift their arms up, and then interlock their fingers, hold on to themselves, and try to pull their fingers apart, but don't let themselves do that. So as they're trying to do that, right, then you can actually strike the knee and see if that elicits the reflex. All right, then in a situation where we notice when we do the stretch reflex that they kick their leg out really far. So we're like, oh, this person has a pretty irregular or abnormally strong reflex or response here. So in this situation, we are going to think more about what we call an upper motor neuron lesion. And so we're going to think of something up in the upper motor neuron there. So we'll be thinking that there's some sort of damage to the brain or the spinal cord. Now, if it's one quick kick, no big deal. But sometimes if you tap that patellar tendon and the leg will start to kind of shake, it goes into that kick motion and it stays extended, but yeah, it'll start to kind of quiver back and forth. It'll oscillate back and forth. We refer to that as clonus. Depending on how long that clonus occurs, can kind of guide us in a direction of our diagnosis as what we're thinking, all right, when we see this hyperactive response. All right, folks, I hope you enjoyed this video. If you have any questions, you know what to do. Contact me. Enjoy. Have a wonderful, wonderful day, and good luck with everything.